the Johannesburg Emergency Services appealing to religious groups to stay out of rivers. The high rainfall has raised the river levels, and just this week, 2 women were swept away while performing a cleansing ceremony. Our reporter Zola Sholwana is covering this story for us, and she joins us live. Zola, good morning to you. So these calls for people to avoid river streams, particularly at a time of heavy rainfall, are they being heeded? Because there is a huge safety element to this.
Well, certainly, Xoli, what I can tell you is that you would understand that previously, before this case of 2 women that were swept away, in a cleansing ceremony, there was also a situation which we covered where 2 young people were actually swept away in a river by Klipspruit. And you'd understand that that has raised a lot of concern in society to say what can be done to prevent such from being happening, with the emergency services also sending out a message to traditional and religious leaders to actually take a stand and also make sure that they do not take their clients closer to, streams, especially when it's during a flooding season. And I'm joined by, a traditional healer who actually get to, paint us a picture, rather, actually explain to us how do people then identify, traditional healers that are, well trained enough to conduct such, and also when can they do those? What is the perfect season? As you'd understand that EMS is saying that such should not be conducted, such rituals rather, should not be conducted during a flooding season. So thank you very much for your time. I mean, you'd understand that, these cases have actually raised a lot of concerns, and the focus is on traditional healers and religious leaders that are believed to be the ones that are conducting these rituals and taking their clients to these rivers. If you could just tell us, what can be done to prevent such, from happening? When is the perfect season to conduct such rituals, if there is?
Good morning, Zola, and to your viewers. I am Dr. Esby. This is it's a very sad phase for us as practitioners, Zola, in that by now one would assume that all traditional health practitioners actually understand their calling, actually are fully informed in terms of knowing the different seasons as to when to be doing these cleansing ceremonies at your streams, rivers, etc. You see, this speaks exactly to the issue of many charlatan practitioners out there, people who are not well and properly trained to be actual practitioners. These are chance takers, people who just want to make money, people who've got absolute disregard for this entire sector of healing. And I don't think it's going to be appropriate for me to respond to this question on national television in terms of when are the perfect and the proper times to go to these streams. I can't be doing that, because then I would be feeding them information, I would be capacitating them. People who have been properly initiated and trained would have been told by their principals or gobelas what the exact and proper times are to do these cleansing ceremonies. It is indeed very sad, and in this instance I want to emphasize from a community point of view. It is absolutely sad that our communities are the ones that have to suffer, as our greatest stakeholders. So by the way, our community members, our patients, they are our greatest stakeholders. And I think we, as the African traditional medicines sector leadership, we have that responsibility of ensuring that we need to disseminate as much information as possible. This year, 2024, we are actually embarking on a program whereby we feel, 1, we need to hold a lot of workshops with the actual practitioners themselves. We have already started, and 2, by extension, we equally want to include and involve the community. People need to be told, Zola. People need to be told. It's really sad that you find that our charlatan practitioners, because that's what I want to call them, right? They're bogus practitioners. It's really sad to take advantage of people who are in dire need of help.
Now, speaking about taking advantage of people, I'll bring you back to the case of Klipsveld River, right?
Yes.
Where Klipfontein, rather, where 2 young people perished in that river during a cleansing ceremony that was allegedly conducted in the evening, and there were also allegations that the traditional practitioner was also drunk or under the influence of alcohol.
Correct.
Your sentiments on that?
You see, exactly my point, Zola. Number one, any properly trained practitioner would know you would fast before you go to any river. More especially if you want to go after sunset or at night, right? Without going into specifics and details, it is a very rare and exceptional case for any practitioner to take a patient to the river after sunset or at night. I know of these cases and I know why that would happen. But I'm saying, when you do that, right, as somebody who's not properly trained, the fact that you go to the river under the influence, that on its own is a red flag. That is an indicator that this person does not know what he or she is doing. I just need to be frank about that. And it is quite sad that when we, as the sector leadership, tried going after this case and investigating it, we were actually quite shut by that family, the Dlamini family. They did not allow us any communication and further intervention into this case. However, the point that we are making here is not about the family. It's more about this guy calling himself a practitioner. And Zola, I will emphasize and reiterate the fact that we, as the African traditional medicine sector leaders, we are coming after them. I'm not going to divulge a lot. We do have, and we are creating stakeholder relations with SEPs, especially the social crime division. It's there, it does exist. We are working with them, and we are coming after these guys. It doesn't matter how long it's going to take us. The bottom line is, we are going to restore the dignity of this practice and this calling.
Now, community members, before I let you go, your clients, what should they look out for in terms of those who are willing to conduct, this ritual of cleansing? What should they look out for when they are, being taken to rivers? As you understand that when we had a chat earlier on, you mentioned that, the river where Ayapiwa and the other, young men perished, people were not allowed to conduct. Actually, traditional healers are banned from using that particular river. Correct. For obvious reasons. Correct.
Look, as traditional healers or practitioners, we have long identified the danger of that specific river. In as far as what do people look for in practitioners, unfortunately there is no one specific thing that we can say it will identify you. Because I can't say to you a certificate in somebody's ndumba or somebody's shrine is sufficient to qualify that person. You can print a certificate, it can be fraudulent, you see, the other thing as well, in furtherance, Zola, before people get to taking each other to any river, there's an indication that these people would have been in a relationship. There would have been prior steps that would have been taken, I'm saying we as the sector need to make ourselves visible. But in trying to respond to your question, there isn't anything specific. We don't have a specific office where we can say, go to this office, we can then authenticate whether this person is a true practitioner or not. Unfortunately, at this moment, these are part of the programs that we have for this year. I'm really hoping that somehow I'm satisfying the public in regards to this question that you've posed to me.
Thank you very much for your time, Doctor. Now, Xoli, he was basically saying that as an association, in this particular year, they'll be working towards making sure that they come after, those people that pose themselves as traditional healers, tarnishing the image of the real traditional healers in society by conducting rituals in seasons where one is not supposed to be conducting such rituals. And also he mentioned that there needs to be a lot of education in terms of, communities and the public as to what they need to look out for and also their role as well, just to make sure that they don't find themselves themselves in danger, making sure that, rather also mentioning that they have to get rid of ignorance. Basically, there has to be education in this particular case, just to ensure that everyone is aware of what is really happening, and also they are adhering to the warnings and actually the warnings that are being set out there, especially during flooding season. Oli, back to you in studio.
Zola, Sholwana, thank you very much. Very, very important discussion indeed there.